Today, we're diving into a condition where the body quite literally declares a civil war on itself. We're talking about systemic lupus erythematosus, or as most of us know it, lupus, a really complex disease where your own immune system, the very thing designed to protect you, becomes the attacker.
So let's start with a wild thought. Imagine that sophisticated army that lives inside you, your immune system, suddenly gets confused. It completely loses its ability to tell friend from foe. And instead of fighting off invaders like bacteria and viruses, it turns its weapons inward, on you. Well, that internal confusion, that's the very heart of what lupus is.
A good way to think about it is like this. A healthy immune system is your loyal guardian, right? It stands watch 24/7, protecting you from anything that's not supposed to be there. But in an autoimmune disease like lupus, that guardian turns into a traitor. It gets its signals crossed and starts attacking the body's own perfectly healthy cells and tissues. So let's really explore this idea of a guardian gone rogue. We're going to use this metaphor of the body as a battlefield to understand just how this protective system can betray the very thing it's sworn to defend. The clinical term for this betrayal is autoimmunity. It basically means the body loses what's called immunological tolerance. That's its natural, built-in ability to recognize its own tissues. It's like the system's friendly fire protocol completely fails, and it starts painting targets on perfectly healthy cells. So what on earth sparks this internal conflict? And how exactly does the attack actually unfold? Let's take a closer look at the triggers and the tactics of this invisible battlefield. Well, the honest truth is, we don't know the one exact cause. What research points to is kind of a perfect storm of factors. First, there's a really strong genetic component, so a predisposition can definitely run in families. Then you have environmental triggers, things like UV sunlight or even a viral infection like Epstein-Barr, that can kind of awaken the disease. Hormones, especially estrogens, seem to play a key role too. Some scientists even talk about the hygiene hypothesis, the idea that our super clean modern lives might leave our immune systems a little bored and more likely to misfire. So once these triggers flip the switch, what are the weapons used in this internal war? Well, they're a special kind of antibody called an autoantibody. You can think of them as rogue agents. Instead of targeting foreign invaders, they lock onto the body's own nuclear material, the very core of our cells. And the most common type, found in over 97% of people with lupus, are called anti-nuclear antibodies, or ANAs. This attack causes damage through a pretty specific chain reaction. It's like a cascade. First, some kind of trigger activates the immune system. Second, specialized cells, B cells, start churning out these faulty autoantibodies. Third, these autoantibodies grab onto the body's own cellular material, forming these little clumps called immune complexes. Fourth, these clumps travel through your bloodstream and get stuck in different tissues and organs. And finally, wherever they land, they spark massive inflammation, which is what leads to organ damage. So, this brings us to the evidence of the battle. How does this invisible conflict actually make itself known? Let's look at the symptoms and the signs that start popping up on the front lines of this internal war. But before we even get into the symptoms, it's absolutely critical to talk about who's most at risk. And the numbers here are pretty staggering. Lupus overwhelmingly affects women, with a female-to-male ratio of about 9:1, and it usually appears during their childbearing years. For more than 90% of people with lupus, the first signs of trouble are these general constitutional symptoms. And we're not talking about just feeling tired here. This is a profound, overwhelming fatigue. When you pair that with a persistent low-grade fever, unexplained weight loss, and just a general feeling of being unwell, it's like the body is constantly pouring all its energy into fighting a war that just never ends. And because those immune complexes can get stuck just about anywhere, lupus is a systemic disease. The battlegrounds are widespread. The skin is a really common one, which can cause that classic butterfly rash across the face. Up to 90% of patients get arthritis in their joints. But it can also attack vital organs, like the kidneys, causing lupus nephritis, the lining around the lungs and heart, and even the brain. So, given how different and varied all these symptoms are, you could probably see why diagnosing lupus is so incredibly tricky. It's often called the great imitator, because its symptoms can look like so many other illnesses. For doctors, it's not a simple test. It's really more of a detective mission. I mean, this quote from the National Center for Biotechnology Information really sums it all up. There is no single gotcha test for lupus. Clinicians have to become detectives, piecing together clues from the patient's story, a physical exam, and a whole series of lab tests. The investigation almost always starts right here, with the ANA test. A positive result is a huge first clue. It tells doctors that the body is making those rogue autoantibodies. But here's the catch. A positive ANA can show up in other conditions, or even in perfectly healthy people. So it's a very sensitive test, but not a very specific one. On the flip side, a negative result makes lupus very, very unlikely.
To get closer to a real confirmation, doctors have to look for more specific markers. So think of that ANA test as finding a footprint at a crime scene. It shows someone was there, but you don't know who. Antibodies like anti-double-stranded DNA and anti-Smith, well, those are like finding the suspect's fingerprints. They are much more specific to lupus and really help nail down the diagnosis. So all of these clues, the symptoms, the lab results, they all come together in a formal scoring system. Doctors actually assign points for different findings. For instance, having arthritis in several joints might be worth 6 points. And then having that highly specific anti-dsDNA antibody could be another 6 points. If the total score adds up to 10 or more, that confirms a diagnosis of lupus. Okay, so once lupus is finally unmasked, the mission completely shifts from diagnosis to management. And since there's no cure right now, living with lupus isn't about winning some final victory. It's about negotiating a lasting truce and managing a lifelong campaign. Yeah, the modern goal of treatment isn't a cure, it's about control. The whole idea is to calm the immune system down enough to achieve remission, that's a state of low disease activity, and most importantly, to prevent any permanent damage to vital organs. And while doctors used to rely on broad immunosuppressants, the field is thankfully shifting toward more targeted therapies that can pinpoint the specific rogue cells, which means better treatment with fewer side effects. Managing lupus effectively is really a multi-front effort. It all rests on 4 key pillars. You've got medications to calm down that overactive immune system. You have crucial lifestyle changes, like sun protection. There's regular monitoring to catch flares early. And then there's coordinated team care with a whole group of specialists. Let's just zero in on a few really critical takeaways for management. A type of anti-malarial drug called hydroxychloroquine is a cornerstone therapy for pretty much every patient. Sun protection, that's not just a good idea, it is a medical necessity to prevent flares. Quitting smoking is absolutely crucial. And success really truly depends on having a coordinated team of doctors, each managing a different piece of the puzzle. And despite how serious this disease is, there is so much real hope. Thanks to all these advances in diagnosis and management, the prognosis for people with lupus has improved dramatically. I mean, today, the vast majority of patients, we're talking 85 to 90%, can expect to live a long and productive life. Which leaves us with this final, really thought-provoking question. We've learned how to manage the truce, how to control the rogue guardian. But as our understanding of the immune system gets deeper and deeper, can we one day find a way to re-educate it? To actually teach it to stand down for good? And restore a lasting peace within the body? Now that is the ultimate mission.